This video is going to talk about how much credence you should place in statistics, because women often say to me, it's bad enough I have to figure out what treatment option to take, but then there's this whole area of statistics. How do I decipher all this, and what does it mean for me? The first thing I want to say to you is this. Should your oncologist start spouting off percentages for a woman approximately your age with your type and your stage of breast cancer, is this: don't feel as if you're going to live or die by those numbers, because you're not. Yes, statistics may be useful, but they're not really going to predict your odds. And that's a good thing, because cancer, it's as individual in its course as the cells of the woman it attacks. No two cancers are alike, because no two people are alike. But if you're the kind of person who likes playing the odds, then use those numbers to place yourself in a better camp emotionally. This means that if your doctor says to you, of the population of women with your prognosis, approximately your age, 5 years from now, 30% of you will be living and 70% will not. Well, just put yourself in the 30% group and go from there. It's all a matter of how you approach life. It's not just about how the cells in your body happen to misfire to cause your cancer in the first place. So don't let statistics dictate your outcome. But if you know going in that you're going to have a difficult time steering your emotions around what your doctor's going to say about the odds, then don't even ask him about or her about statistics. Here's how a well-known breast cancer surgeon explained the ramifications of statistics to me during an interview I did with him on my program of How to Survive Breast Cancer. Dr. Craig I. Henderson said, one of the things that I try to do with every patient early on is what I call removing the sword of Damocles from her head. He said, people even say to me, well, how can you treat a disease like breast cancer? Doesn't it make you depressed? And he said, well, in fact, most of my patients don't die, at least they don't die of breast cancer, and they live for long periods of time with full lives, and for many of them, fuller lives than they had before they were diagnosed. So I tried to help women deal with the real statistics. I really liked how he put that. Then he did an interview on national television, and Dr. Henderson emphasized mortality rates when he was questioned about the so-called epidemic of breast cancer. He said, people talk about the number of women getting breast cancer, but getting the breast cancer and dying of it are two different things. And although a lot more women are being diagnosed, the number who are actually dying from breast cancer, it's increased only slightly. So in light of his comment, things are actually improving from an outcome perspective. But I believe that it's also so very important, especially early on in the process, that the oncologist or someone on your cancer care team begins to foster in you the belief that you do have something deep within you that's going to help you survive all this. Ask almost any woman who has gone down that path before you, and she will tell you that this is just as important as anything that anyone can provide on the outside. And during that roller coaster of emotions, those first few days, first few weeks after you're diagnosed, grabbing onto that faith in yourself will hold your fear at bay so you don't panic and do things now that are not, in what you might consider later, in your best interest. Remember, numbers can and do lie. So grab a hold of your faith and hold on for dear life.